If you think about our healthcare system,
Yep.
the science is great, the medications are great, they're better than ever. And yet our health outcomes are not really improving at the same rate or in the same proportion.
What are the different social determinants of health?
The data shows that for the average person managing chronic health conditions, only 20% of what influences their health is related to the access to healthcare and the quality. The other 80% of those influencers are found in the socioeconomics, the motivations. These are all things that are not today really addressed in the doctor's office.
Great to have you on, Amy.
Thanks, Harsh. It's great to be here. And I really appreciate the opportunity to discuss this topic that is so important when we think about healthcare in general. The fact that right now we are not seeing the outcomes overall and the healthy society that we want based
hmm
on the amazing healthcare that we've had to date.
Yeah, and I know you, based on the stuff I've researched about you and read, I know that you stress a lot up on the social determinants of health and why all of these are important. So before we go into too much detail and talk about why they matter, can you set the stage and let our audience know what are the different social determinants of health?
So, the social determinants of health are the conditions in which people are born, grow, live, work, and age that shape their health. That includes factors like socioeconomic status, your education, the neighborhood you live in, that physical environment,
Mm,
your employment status, and things like your social support networks, as well as access to healthcare.
yeah.
And so, all of these factors, these elements, are really what make up the social determinants of health. And it's really about how we live our lives every day in the environment in which we live
hmm
and those experiences that we're having. And so addressing the social determinants of health is important for improving health and reducing the long-standing disparities in health and healthcare that we've seen. We have the science, we have a lot of great solutions as far as medications, surgical interventions, and things like that. But we're missing the fact that a lot of the ability to engage in those great offerings and
hmm
solutions are rooted in the social and economic disadvantages that we have based on these social determinants of health.
Right, right. Yeah, and this is, when I think about it now that you explained, you mentioned depending on which neighborhoods you live in. Like I've lived in many different states in US since I've been in this country 15 plus years, and I've seen, the type of pharmacies, the type of even retail stores in cities like New York or San Francisco versus, rural Pennsylvania, like central where, it's in a small town. The stores are still there, but the design of even the Walmarts and Targets is different than the one in San Francisco or Boston versus central PA. And the same is true for hospitals, pharmacies, health medical practices, and so on. So that's a really important point. And if you're living in those areas, you have less options or more options depending on if it's a big city. So that's a great point.
Absolutely. The other thing that's important from a data standpoint, why are the social determinants of health important when we consider health equity? The data shows that for the average person managing chronic health conditions, only 20% of what influences their health is related to the access to healthcare and the quality.
Mm,
That sort of that clinic setting idea. The other 80%, which is an overwhelming percentage, the other 80% of those influencers are found in behaviors, the socioeconomics, the motivations. Those are the social determinants of health.
mm,
And these are all things that are not today really addressed in the doctor's office or from a clinical standpoint because it's difficult to do that. But it matters because we need to understand that 80%, the social determinants of health, in order to improve the health outcomes beyond where we are today. And we need to combine that 20%, that clinical scientific intervention and engagement, with the 80%, which is really understanding it's a holistic person-centric understanding.
Mm.
It's understanding the patient as a person first, not a patient, but understanding you as a person. None of us identifies as a patient.
Yeah.
We are, you're a podcaster. I work for the HitLab, and we're moms and dads and teachers, service workers. We've got a lot going on in our daily lives, and our health is important. But in order to really have a good health and wellness of our daily lives, we have to be understood for the people that we are. And that's the 80%. In order to be able to deliver those better health outcomes, we have to combine this understanding of the human being with the clinical science side of things.
Mm. So when this statistic that you mentioned is very interesting, but what I want to ask you to dig a little bit deeper on that is, why are these areas staying behind, and how can they sort of shift, that 80% to maybe 70 or 60 or 50?
Sure. Well, I think a lot of it is, I don't think that the data points are necessarily going to shift. Like,
Mm.
the point really is that 80% of what influences your ability to have a good health outcome is really based on how you live your life and
Mm.
your environment, the social determinants of health. So it's important that the healthcare ecosystem, the stakeholders, as well as the people, the end users, the patients ourselves, that we recognize this, because these are the things that are going to need to be addressed on an individual basis, or as closely as we can get to an individual basis as possible, to really move the needle on these health outcomes.
Mm.
And so that's where things like technology, I think, can play a huge role to shift where we are. Because if you think about our healthcare system,
Yep.
the science is great, the medications are great, they're better than ever. The clinical interventions are better than ever. And yet our health outcomes are not really improving at the same rate or in the same proportion.
Mm.
And again, that's because we haven't really understood the human side to this, and understanding how all these other things impact your ability to engage in your health and wellness. But that's where, again, technology, I think, can play a role to bridge that gap, to really help bring this sort of the clinical support with the fact that, social determinants of health are playing a huge role.
Mm-hmm.
Meaning that resources that we have through technology, like telehealth, remote
Yep.
patient monitoring, the
Mm-hmm.
Internet of Things integration, AI technology with voice recognition. And these create opportunities to support people in their daily lives based on the ability to capture data from sensors, wearables, again, the Internet of Things,
Yep.
and provide that insight that can support the right clinical interventions for the person based on how they live their lives, and from the behaviors, their nutrition, their activity level, even their environment. And
Mm.
so I think that the technology can really help bridge that gap, to help the clinical and scientific side marry that human social determinant of health side together, and to create that insight and support the better health outcomes. So that's really
Mm.
what we're talking about here. And again, I think it also supports the opportunities that we have. You mentioned like rural and urban communities. Rural communities might not have the access to the care that you might have in a more urban setting. But again, these technologies can support that remote engagement, again, through telehealth services, remote patient monitoring, and these sort of virtual connections that can create an easier way to connect the remote areas and support better health engagement, and potentially even earlier interventions to mitigate potentially things that could get worse if they're not addressed early on.
I see. Okay. Yeah, and also this reminds me of, you mentioned about remote patient monitoring, and I was working with a consulting client, and they're evaluating different devices for measuring how well your lungs work, like how much air you breathe in and out. So they're evaluating multiple global manufacturers of these I think it's called a spirometer that you
Yep.
basically breathe in.
Yep.
And one of the companies they were evaluating had a mobile app. And they actually demoed the app to us that every time the patient ran the spirometer, it would, show the data. It would show like a nice visual. They would have to pair it with their app, and the app would like show the breathing, bubble in and out. And it was just a really intuitive interface, and helping the patient understand why it is needed, right? Like explaining to them, not just, hey, here's a spirometer, do it and write down, or just like a thermometer where you see a reading, just write down. That's not as intuitive as this one manufacturer that had this amazing app. And I was like, wow, this is interesting. And it does help with the adoption and getting access to that data for that manufacturer, so they can analyze that however they want.
Absolutely. And I think an interesting trend that we're seeing is that over the last few years, we've seen a lot of these types of apps come into the market, which is
Yep.
great to capture data, ambiently or even, consciously, actively, whatever. But now what we're starting to see and hear is that these sort of apps or point solutions, which are
Yep.
really good, that's no longer enough because the world doesn't need another app, right? What they're
Right.
wanting to see is an integrated platform. If
Yep.
you're going to develop, if you're an entrepreneur, or you're a startup, or you're even playing in the digital health space as a point solution provider or developer, it's really important to think about how are you going to be embedded and integrated into existing platforms that hospital systems are using or manufacturers are using or people are using.
Yep.
Are you part of the Apple Watch or Apple Health? Are you part of a health system platform? Because what you don't want to do is to create something that requires more work. We want a
Right.
frictionless application and integration
Yep.
that allows the data collection to be seamless, but also that data collection to be pulled into a larger platform so that you're getting more holistic understanding of what's happening with the individual to provide that more personalized intervention that delivers that hopefully that better health outcome.
Yeah, yeah. But even when you look at browsers like Google Chrome, Microsoft Edge, Firefox, and all these different extensions and apps that are available, the ones that are designed to work with most of them in a seamless manner are getting more downloads, more subscriptions,
Yes.
and whatnot. And the one that have a lot of friction, like, oh, I only work with this browser and this setting. Well, guess what? That's not the most favorable way that a user wants to use that app, unless they're extremely passionate about it, and that's the only app on the market, right? So it's happening everywhere. It's not just in healthcare; it's also in tech and other industries. Yeah, I want to switch gears and talk about the work you're doing at HitLab. So I know that you're leading the women's health tech initiative there. If we are to focus on just now women's health, going from overall healthcare to just women's health, what are some of the barriers there that you're seeing in your line of work? And is technology, AI, all of these data, all of these things, how do you think they can specifically help women's health?
Sure. I mean, I think it's fair to say that, women's health, women in general, we still face pretty persistent barriers to accessing health services. And these are based on things like cost, gender bias, discrimination, stigma about women's health issues. And there's been a lack of funding in this space.
Hmm.
Overall, the US health system was not designed for or by women. So that's important to keep in mind. And I think that contributes to some of the challenges that we see.
Hmm.
And so as a result, the health needs of women have historically been under prioritized.
Yep.
And I think just as a data point, which I think is really interesting, is in 1977, the FDA recommended excluding women of childbearing age from participating in clinical trials for most drugs.
Hmm.
This law changed, or this ruling or advisement changed in 93. but the policy resulted in a limited understanding of women's health issues because we lost all that time and
Interesting. Yeah.
introduced significant knowledge gaps when it comes to women and women's health. So, for example, we know there's been a lot of progress in the cardiovascular disease space, but a lot of that's been based on male physiology anatomy because women weren't included in those trials. So there are, potentially differences in diagnosis and treatment for women as compared to men. We just don't know.
Mm,
And the good news is we've had a steady increase in the representation of women in clinical trials since then, but there is low, recruitment remains low, unfortunately, for women. And we still need to improve this because women are really only accounting for anywhere from 30 to 34% of participants in industry sponsored early phase trials. So we've got a long way to go there. But again, this I think is where we have an opportunity in a tech space. I think the technology, again, just like we've seen with social determinants of health, can help bridge some of these gaps that we have seen to help accelerate understanding women's health. So, for example, from an app, we talked about apps earlier. We're starting to see some apps on the market that leverage AI to capture information about women based on their hormones.
mm,
And the hormones are really a lot of what are the differences between men and women. And we also know that women, the hormonal changes in women from cradle to grave have significant impact on health and wellness
yeah.
that have just not been really understood or studied. But we are starting to see now a lot of ability to capture that information through these ambient wearable sensor devices that are going to contribute to greater understanding of women's health and the differences between men and women. Not just, I mean, obviously, there, when we think about women's health, you think a lot about fertility, menopause, and there's a lot of investment going into that space, and that's really important. But there's so much need beyond that in cardiovascular disease, autoimmune diseases. Cardiovascular disease is the number one killer of women. And we
Hmm.
really don't understand the real insight there. So there's a lot of opportunity there, and we're starting to see more and more interest and investment in investing in women's in femtech or women's health tech.
Yep.
JP Morgan is going on this week, and that's been a big focus of the conversation at that conference. So that's really exciting. And in addition, in 23, the Biden administration launched the first ever White House led initiative to focus on improving the way the federal government approaches and funds women's health and women's health tech. So there's going to be more and more opportunities for those who are interested in working in this space for grant money and opportunities from the federal government to invest in help support the work that they're doing to bring their solutions to market that will accelerate better understanding of women's health and hopefully improve the lives of women.
Yeah. Yeah. When you think of digital health or the future of digital health from like a 30,000-foot view, are there any other big picture ideas that you think might happen in the next 5 or 10 years?
Well, I think the big trends that are really going to drive the future are really in two big areas right now. One is AI.
Yep.
Everybody's talking about it.
Yep.
And I think that's going to really do a lot to support, all this data that we have out there. It's a lot. And it can really sift through the information much faster than a human being. So we're going to
Mm,
see a lot of opportunity with using AI to capture data, but also process and help with decision making and insight. And also, even from an end user, from the patient using this, it gives us a better understanding of what's happening in our lives and in our bodies so that we can be more proactive. So I think that's really
yeah.
exciting and moving more toward this prevention and wellness model, well care model. The other area would be, again, going from the point solutions to the platforms, integrating a lot of these different apps, remote patient monitoring components, AI technologies into platforms that support that holistic data collection
Mm,
and insight. And so I think we're going to see more of that consolidation and integration. That's going to
yep.
be really important too, to really drive, and also support personalized interventions and health outcomes that also ultimately help bridge that health equity gap that we see with different populations and different communities.
Yeah, the integration part is really an important thing to know because yes, you have multiple apps, but then if every app is throwing out data in that their preferred format, And if you are a pharmaceutical or biotech company or a manufacturer of these devices or apps, and you're trying to analyze the data, well, now you've created more work for yourself, because now you have, 5 different data formats and spreadsheets and whatnot. So yeah,
Yep.
that integration on the front end is always better, less
Yep.
time consuming, maybe more time consuming, but more efficient down the road, because you don't have to like look at 7 or 8 different data types to figure out what's going on.
Yeah, I think a key word there is friction or frictionless. Like
Yes, yes.
you want to create a frictionless opportunity.
Agreed. Well, Amy, thank you so much for your time. I know you have to jump to another thing that you mentioned to me earlier. Love everything that you shared here today about digital health and access to healthcare, pinpointing towards what can be done in the women's health area. For listeners who've enjoyed hearing you or watching you on this show, where can they connect with you or learn more about you and all the initiatives you're doing?
Sure. So you can go to my LinkedIn, Amy West, and I'm with HitLab. I spent the last 15 years at Novo Nordisk in the
Hmm.
digital health space and in the really the marketing omni-channel marketing space. But really, my love was really in the future of healthcare, which is really in this digital health and health innovation space. But go to LinkedIn, or obviously you can you can go to the HitLab, hitlab.org, and go from there. But I would love to connect with anyone who wants to talk about this. And Harsh, it was such a pleasure to talk with you. I appreciate the opportunity and would love to talk again sometime.
Yeah, thank you. We'll put those links in the show notes of this episode so people can find your LinkedIn and HitLab website. And if you enjoyed listening to this conversation, I highly recommend to check out one of our other episodes with Bethany Corbin that we've had in the past. She's extremely passionate about femtech and women's health. So if you enjoyed some of this, you might enjoy that episode, and we'll put that link somewhere here on the screen. That's it from me. Thank you, Amy. Hope you have a great week and a great year ahead, 2025.
Same to you.
Yeah,
Happy New
thank you.
Year. Thanks,
Thanks.
Harsh.
Bye.